So our speaker for this evening is Dr. Ken Holtorf. He's the CEO and president of Holtorf Medical Group. He is a internationally recognized speaker on thyroid, on peptides, Lyme,
multisystem illness, published a number of studies. I think we might have some of them back there, I don't know, on controversial topics like treating patients with a normal TSH. And some of them I would, they got 400 references showing that the way we're treating thyroid in this country is wrong. Going by the TSH just totally misses anyone with chronic illness, inflammation. So, you suppress the TSH and you'll find some doctor freak out and they call the medical board. But I would put it in the chart so it becomes part of the chart. And we've used those 2 reviews. Done expert testimony for a bunch of doctors. Pretty much everyone but one, which I refuse to take twice, but because it was so egregious. But just I'll just give you a little background on kind of how I got into this. In medical school and residency, started feeling just so fatigued. And I'm like, something's wrong. Of course, you get university doctors and they go, oh, you're depressed, you're stressed. I'm like, I'm not. I can't function. I got such brain fog. Like anything, especially physically or mentally stressful, I was just down. I go, I can't see patients, And so I was going to drop out and said, well, let me go into anesthesia because you don't have to talk to them, they're asleep, right? And then, and I was, it's ingrained in you that any alternative conference has no evidence. I turn it up a little. Has no evidence, and so I go, oh, I'm not going to tell anyone, but I'm going to go to some of these alternative conferences, and I go, holy crap, these are more evidence-based than what they're teaching me in residency, and then so I started treating myself, and especially with hormones, T3, lifesaver. If you have any one thing to do in your practice, learn how to do T3, and you have people knocking on your door. I'd say our top 3 treatments, peptides have changed our whole practice philosophy, especially for good or bad. We've just attract the sickest Lyme patients have been everywhere, and I myself had, so then I had chronic fatigue syndrome before it was chronic fatigue syndrome, and then did pretty functional. I'm like, wow. And then so I'm like, I don't want to be in anesthesia. This is the most mindless specialty. I apologize if there's anything in anesthesia. But so I just went and started family practice, and incorporated those and took over a practice, and then converted to cash. And everything was going great. Started a beer company when I tried to get out of medicine. But it was fun, but we did not know business very well, and then set up 22 centers around the country, and then we did like franchises, and a hospital actually bought the first franchise, but it actually turned out to work too well. So all the doctors just got so mad that we were basically, they said, saying that they don't practice good medicine, and started to fly up there, but they were saying that we're not evidence-based. So I said, okay, I'll take that challenge. And I went and gave a talk. The wrong thing to do was prove we're evidence-based and they're not. And then they said, you have to go talk to the CEO. He's so pissed, you're going to be out of here. So I sit down with him and he goes, you know what? I've sent my wife to every one of these specialist clowns and they could never fix her. 2 visits at your clinic and dramatically better. But then I heard they had a staff meeting, emergency staff meeting, and the guy described it as Frankenstein, the picture where everyone's with torches and pitchforks, get them out, So we were going to divest and stuff, but it didn't work. But then, so I was doing well. Then all of a sudden I went through a stressful divorce, and after 3 years of that, just hit by a truck, sweating, just couldn't get out of bed for months, went into heart failure, and I couldn't even stand up, just like walking around. And so I kind of said, okay, I went essentially around the world finding new treatments. And one of the things I did, I found peptides in Belgium, which dramatically helped. I kept flying back to Belgium, cameling them over, waiting to get thrown in jail or something. But and then that's how we incorporated those. So I would say 3 things to do in practice for especially these chronically ill patients that are non-responsive. T3, and even they've been like all these major names, and they don't do the thyroid. Just doing that can be huge. Peptides by far, fixed immunity, and we're going to talk about that. And stem cells saved my life. And then the cardiologist said, basically, you could probably improve your heart function 10% in 10 years. 2 years back to normal. And he's like, how'd you do that? Of course, they don't care. They're not going to say, oh, I want to do that too. But, so
Did you have stem cells into your heart?
No. It was IV and everywhere. But yeah, I did a lot of weird treatments, and but I remember going to New York for direct ozone. It was so easy to learn, but I remember going to the plane just sweating, walking 1 mile an hour, and just anxiety like crazy. But yeah, I feel better than I have in a long time. I've been last 3 weeks sleeping 4 hours a day, beating up my body, and still feel great.
I'm sorry, what was the cause of your congestive heart failure?
They presume viral. Or they threw infectious. It was lying. Yeah. And I had Babesia too, which I think is way worse. And then, so I also did 3.5 years of the highest dose IV antibiotics that I would never give a patient, like 5, 6, 7 antibiotics at 3 times the dose, 3.5 years. A month later, back the same. And then it's funny, I went and had carotid gland inflammation, which I've never heard of. I went to the ENT. He goes, yeah, you got inflammation, take antibiotics. I'm on 7 IV. But anyway, so all these things have been a lifesaver for me. And so I was going to, a lot of times I'll give a peptide talk and kind of go through everything, and people are just like, oh my God, it's just overwhelming, because there's so many peptides that do so many great things. But I want to concentrate. This one is, jumpstart your practice, what you can do, on Monday. And how many people are like chiropractors, how many people are doctors? Because I remember last time a lot of people couldn't prescribe meds, right?
Yeah.
Okay, so we got an answer.
Well, how many people can prescribe meds? Yeah, that's what I said, can.
Cannot.
Yes, who can prescribe meds?
Okay, switch
Yes.
that. Okay, so the can, so do the can. So you guys like this, so I'm going to concentrate on probably, which the biggest thing is, I think, across the board, by far, we use more Vpc, and other doctors find the same thing. You sound like a snake oil salesman because it just helps so many things. I'll give it to so many things that help. Friend, I got knee pain, take it. Oh my God, it's gone. I've had it for 3 months. Gut, best thing for leaky gut. Brain, Sean. So we'll go through all those studies. But so what I'm going to talk about first are some of the things that can be used that are supplements. We have the Vpc supplement. Again, better than the pharmaceutical grade at 1/5 the cost, I guess. And then we're coming out with a thymosin beta-4, which we'll talk about that, but it's a fragment, which is the active fragment without some of the parts that it did a little like mast cell activation that's taken out, but totally orally available. So that should be out in October. But so for people who can't prescribe, you'll be amazed. Just give everyone BPC, the response you get. All right. So integrated peptides. Again, we're working on a lot of peptides, BPC 157, and the response and the feedback we get is huge, and the reorder rate is just crazy. It's like 90%. Then we're coming out with the thymosin beta-4 orally active. Also, the nonprofit National Academy of Hypothyroidism, which has a bunch of studies on there. that again, you can show a patient when they go to this. Basically, you give them T3 or whatever, you suppress their TSH, and their doctor freaks out, you can just send them these studies. And usually they'll never call, of course, and go, oh, this is interesting. Endos especially. Or it's funny, it's typical, I did a review on HP axis dysfunction and chronic fatigue syndrome fibromyalgia. So adrenal fatigue, right? I don't like the term, it gets a little overused, but it was pre-publication. I gave it to a patient who had a little cortisol. He gave it to his endo, and then he goes, I saw that's a terrible study. He goes, this hasn't been published yet. And then he takes it and looks and goes, I don't need to read it, and do it in the trash.
Wow.
Yeah, that's classic. So, all right. And then Holtorf is our in-house supplements. So what are peptides? And Ben talked about that. They regulate almost every known process in the system, tissues, cellular specific, where hormones are generally slow on, slow off, have broad-based effects. Peptides, much more specific, although they do have some multiple functions, but much safer. The safety profile, and most of these, they can't find a toxic level. They'll give 1,000 times the dose, and nothing. I even tried myself. I took like 100 times the dose IV. I'm fine. In fact, yeah, we use it IV now, orally, sub-Q. Works great with stem cells. If anyone's doing stem cells, do the peptides with the stem. They dramatically improve the effect of stem cells. So again, everything from immune function, which we'll talk a lot about, sleep, especially for inflammation, DNA replication. If we get to it, we'll talk about one that increases telomeres. It's probably the ultimate anti-aging peptide and battalion. Cancer cell destruction, also more anti-cancer. Libido, PT141. I don't think I've ever seen it not work, especially for like people who fail Viagra. And you got to watch out a little bit because you could be doing your taxes and like. Works on women as well. It's actually in a phase 2 or 3 trial for, or maybe just approved for sexual dysfunction in women. Now, it is part of melanotan, so, but it's a truncated version, so you can also get tan, and it also lose weight. So, yeah, lean muscle, metabolic, increased amount of, so many things, increased mitochondrial function, which is shown to be an issue with so many chronic illnesses and just aging. Functioning brain fog, a lot of work great. Urinary and reproductive systems. So a lot of effects. Again, extremely safe. Some of them, there's no study that's shown toxicity. And so a lot of new peptides coming out. Well, hopefully they'll stay with their, we'll see what happens with all the compounding laws for the injectable ones, So here's just a general class. There's more than this, but kind of some of the main ones. So immune modulating peptides, the thymosin. So your thymus, it produces a number of peptides that modulate the immunity. And if you look at the immune system, if you look at, basically broken down TH1, TH2, they usually should be balanced. But with any stress, inflammation, chronic infection, like Lyme and chronic fatigue syndrome, fibromyalgia are kind of the model for this, but autoimmunity, toxins, what happens, the TH1 drops, TH2 goes up, so you can't fight the intracellular infections. So many people are infected with a lot of things, including Lyme. We're to the point where, damn, I think everyone has Lyme. But if you have no other problem, you're probably fine. But it's when you get mold and other infections. And then the TH2 causes a lot of inflammation. So you get tons of symptoms, fatigue, achiness, brain fog, migraines, diabetes, you name it. So thymosin alpha 1 increases TH1, thymosin beta 4. No, that's a typo. It will more balance. It will increase TH1, lower TH2. I don't know what I got there. Vpc is probably the number one thing to start with. It's so toxic, no side effects. It decreases the TH2. It's a healing hormone, and that one's absorbable and stable in the gut.
For immune purposes, what would be a typical dosage for VPC?
Yeah, so it's for the sicker the patient, will start higher because it's so safe. Kind of same thing with growth hormone we do. We start high and then drop down. But sometimes we'll do for the sickest patients 3 caps 3 times a day for a couple of weeks and then wean down there. Standard dose is 1 cap twice a day. As they get better, you can
And each cap has how many milligrams?
500 micrograms.
Okay.
Synergistic, all the peptides are very synergistic. Sleep peptides, there's the delta sleep inducing peptide, which is great, but you add it to the epithelium and it can be magic for those people that don't sleep. Again, it does so many things for anti-aging. It actually brings your melatonin level back up to when you're 25, but a lot of other things. Prevents cardiovascular disease, reduces cancer significantly, especially when added to one of the thymosins and VPC. Probably basically the one that gets the most attention is CDC and ipamorelin, which are growth hormone releasing hormones with a growth hormone releasing peptide to boost growth hormone. I'm not going to talk about that because the other ones are just so much more powerful. And you don't want to be treating bodybuilders, by the way, but with that, you can't overdose on it. It's not like growth hormone. You can't, if you take 10 times a dose, it has a limit. So diminishing returns. AOD is a fragmented growth hormone. Does not increase IGF-1, but lowers inflammation as some of the other properties. We use that a lot into joint injections. So if you do joint injection with PRP, stem cells, ozone, we usually have BPC, TB4, and AOD. Brain peptides, very cool. I couldn't remember anything. Like we would go out to dinner, and the next day, my girlfriend would say, "Oh, what'd you think of?" I'm like, "Who? Who was that?" And it just says, I go, "I've never heard of that person." You know? So Cmax, again, boosts brain function. Also, a lot of these work for traumatic brain injury. I have some studies on BPC and TB4 for traumatic brain injury. Also, cerebrolysin for traumatic brain injury. Also great, all these are great for the neurodegenerative diseases, Parkinson's, Alzheimer's. They can be huge. Again, all synergistic. There's antimicrobial peptides, which we'll use. We you know, I don't know, for good or bad, we essentially just mostly a Lyme clinic that have been everywhere, you know, huge stacks of labs. But LL37 is shown to be much more effective at killing Lyme cysts than standard meds like tinidazole. Rejuvenating pain, BPC 157. Like we'll give BPC 157, TB4, sometimes delta sleep. You take it during the day too. It doesn't make you sleepy. It just kind of modulates the whole system. But someone on fentanyl, they'll go, you know, not every person, but they'll go, "Oh my God, my pain's gone." You know? Mitochondrial energy peptides, like BPC will increase mitochondrial. MOTC is a mitochondrial. It's one of the newer peptides that we're just trying out. Side effects, some people get nausea with some of the meds, especially PT141. You know, either you're going to have a great night as far as erectile dysfunction, or you're going to be throwing up in the bathroom. But very large safety and huge doses. So thymic peptides, there's a number of them. The thymus, it used to be called fraction 5, where they couldn't identify them, just a bunch of different thymic peptides, which they all do a little different, but also very similar. Thymosin alpha-1, which is approved in about 30 countries for everything from cancer, treatment, HIV, colds and flu, I mean, so many things. So it reduces inflammation, which is a key thing, and increases healing. It can dramatically increase healing, like in the gut, and it's shown to for musculoskeletal injuries. It's really a healing hormone, and especially for if you put it on a wound, dramatic improvement in the returning to the healing of that. Again, brain, skin, muscle, degenerative joints, works for arthritis, cardiac. It will, as well as TB4, give it for someone with an MI, dramatically improve cardiac function, or someone with congestive heart failure, works very well. With T3, every heart failure patient is low T3, so do not be afraid to give T3 to heart failure patients. It's key. Neuropathic pain, like, what works for these neuropathies? Vpc TB4, and then he injected me also with some stem cells. Between my toes, I wanted to kill them, but it really helped the neuropathy along with TB4. But, and also block endotoxins and mycotoxins. So, all this, a lot of talk on mold being a big contributor. Also great for the gut, and with the gut-brain connection, we're finding it's huge. It's it is very important. Again, epithelium increases telomere length, increases longevity. We'll talk about a study where at 65-year-olds, 15-year study, they found that their cardiac function improved rather than declining, dramatically less cancer, dramatically less mortality, morbidity, especially for cardiac. Infertility. Epithelium, one study, they gave it to menopausal mice. 80% started menstruating normally, and 25% had normal babies.
How long did that take? Like they gave us that 3 months later, or?
I don't know, everything's crunched with mice. Now, we don't do a lot of infertility. We should advertise more.
When questions come in, if you could repeat the question so everybody else can hear it.
Yeah, so she's saying what time frame was that? Mice are all, that's why they use them, because you get, whatever, 6-month-old mouse is like middle-aged or something. But, so we've given it to some people and their anti-malarial hormone, which shows you the ovarian reserve, even a better indicator of what's likely to pregnancy, and that goes up. So, and a little T3 and a little heparin, and epithelium, and Vpc, all these people that have been to multiple in vitros and fertility clinics, and T3, if I mentioned that, they get pregnant naturally, so many times.
Did you say heparin also?
Yes, most, especially if they get early fetal loss, they're hypercoagulable. And anyone with a chronic infection, like 90% are hypercoagulable. And I think I have a thing of what to test for. And you'll see it, and you treat them with, you can either do a little fibrotic enzymes, nattokinase, lumbrokinase, seropeptidase, and also heparin.
Will you be going into mechanism of action and how exactly these peptides are working?
Yeah, some of them, they're not sure. They have multiple mechanisms of action, and they haven't pinpointed the exact one thing it does. So it doesn't work directly, it works through a bunch of secondary signaling. And it just kind of, it goes in a little black box and what it does, and then we know the effects. There's some thoughts, but I won't go too much into that, but it's like basically very, all these metabolic processes, that's like, what the hell is that?
Now, how many of these peptides have studies in humans, substantial numbers of subjects for a substantial period of time?
That's a very good question. Most are animal studies, and there's some very good human studies as well. Yeah. And we know, I mean, these have been used in the Eastern Bloc, Russia, for 40 years. And you look at the studies, you're like, when I give talks, people are like, why haven't I heard of this before? And so when I started smuggling the peptides back, all of a sudden I was at a conference, and all of a sudden I walked by and TaylorMade, I don't know if you guys know them, they're kind of the biggest peptide supplier of injectable. They're very expensive is the problem. It's kind of why we came out with the supplements that are much cheaper that people can utilize, and you can sell them to your patients and make money, or it's not very expensive to the patients. Where a lot of the injectables are like $300 wholesale, whatever you mark it up to. A lot of times you want to do multiple, so patients spending $1,500 a month just for some peptides. So it's a little tough, and that's why we're expanding, trying to get these things, great treatments for less to the public.
Are the supplements as effective as the injectables?
Yeah, I have some studies showing that with the BPC, it shows that equal potent if it's oral, intraperitoneal, IV, sub-Q.
So it's not half the potency taking it orally versus injectable?
No. I think I have some studies showing same exact effect.
And then TB4, is that going to be calcium?
Yeah, so TB4 will not absorb orally, but we took out the active fragment, which does absorb.
So it's not TB4 per se, it's like a TB4?
It's the active fragment. Yeah, it's, and plus it eliminates some of the negative. And then we have one fragment, works for immune modulation, the other one works for air, so they have they've deduced which fragments do what.
Can you speak to the quality of the VPC 157 and?
Yeah, so we go through so much testing. We go through way more compounding pharmacies, 99% pure, tested for, of course, toxins. And a big thing, like people get stuff online in China, you need TFA, which is like a solvent that's needed to make them, and they don't want to spend the money to basically filter that out. So it's TFA free of any contaminants. We have all those, and we test every batch, and so that's a big thing that we're serious about.
And how are these made?
Yeah, they're generally mostly synthetic, so now they're just printing them in a machine, you put in the sequence, or you can get them naturally, which we are coming out with a natural VPC, but it's from porcine gut. It's expensive, so some people want that. And then TB4, you can get some, basically a thymus extract. You'll get some, but it's just, you never know how much. But we'll list exactly how much.
Where you said that you are isolating the active fragment for the TB4, if there are ones that are for immunity, ones that are for hair loss, etc., which fragment is the one you're putting in the?
Yeah, so we use a 4-peptide fragment. That's the N-terminal. But there's different fragments that most of them will do very similar, but a little different.
So which is the one that you're going to be?
Is for inflammation, immune modulation.
Not the hair loss.
Not the hair loss. We have another fragment for that.
That could be a third product?
Yeah, we'll probably put that in a tonic.
What is that?
Yeah, we'll probably add it to some stem cell cream and exosome cream and add them together. So we come with a lot of unique delivery systems, and we have a way to also alter the peptide so it's so much more absorbable through the skin too. But let's see, where was, so basically the nootropics, improve brain function, cerebral lysin, which is basically was pig protein, brain pig proteins, pig brain proteins. But now it's more synthetic, but that works great. Studies on Alzheimer's, traumatic brain injury, Cmax and C-Link are very similar. Improved brain function, great for traumatic brain injury, as is BPC. C-Link is shown to be a little more calming, but there are more studies on Cmax. Good for, one study showed actually BPC worked better for depression than antidepressants. Good for memory, again, the growth hormone secretagogues, I won't talk too much about. And then the growth hormone fragment, AOD, fragment of growth hormone, and also BPC increases growth hormone receptors. So if you're doing growth hormone, you can save some money and take that. Again, PT141, we talked about that. Delta sleep basically does what it sounds, but also reduces brain inflammation, which is a big problem with all the people with brain fog. And it also works for muscle pain. So sometimes we'll give it throughout the day. Follistatin works for weight loss and muscle gain, but it's a big molecule, very difficult to synthesize and very expensive. Antimicrobial peptides, we in LL37, BPC, TB4, also surprisingly shown to have antimicrobial effects. And then mitochondrial peptides increase energy, MODS, and BPC. Yes?
What about weight gain? What if you don't want to lose weight? You need to gain weight.
Again, well, the interesting thing with like BPC, if your blood pressure is high, it brings it down. If it's low, it brings it up. If you're hypercoagulable, it makes you less. If you can't clot, it brings it up. So it's kind of a homeostatic. But we found we do get great weight loss in a number of people. It reduces insulin resistance, which is a big problem, even skinny people. And then adding it to just, you get T3, because almost everyone's low T3, just dieting. If you diet multiple rounds, your basic metabolism drops, your T4, T3 conversion. The big thing is the body will not, there's an active transporter into the cell of T4 and T3. That drops, and so the labs look great, but not in the pituitary. The pituitary is totally different. It increases T4 and T3 transport, so TSH goes down, and sometimes your T4 will go up because it's not getting into the cell, which is a marker for hypothyroidism. But we're taught low normal TSH, high T4, that's hyper. So, but you can look at reverse T3, which will tell you which one it is. But we also do other tests. We test everyone's basal metabolic rate. People who are sick have dieted significantly and say they've wrecked their metabolism, and people, no one believes them, they have. And when we check it, they're usually 25% lower than a normal person.
Because I'm thinking of a specific person I know with Alzheimer's, and he's just losing weight like crazy. And
yeah,
he doesn't need to lose
it's
weight.
it's from the immune dysfunction.
Mm-hmm.
Just they go in a catabolic mode, and yeah, so fixing that will bring back and healthy. We've seen some dramatic results with it. Yeah, and Alzheimer's, Parkinson's, ALS. We treat a lot of patients with ALS that incurable. They're jogging now. It's a chronic infection, usually Lyme. Almost really every time. You never say or always, but 90% at least. And we called like Michael J. Fox and for Parkinson's, and we said, does he know about Lyme causing this? He said, yeah, he had Lyme and he was treated for it, which the standard doxycycline has shown that 80% of people will relapse on that. So, all right.
Any experience with pelvic floor dysfunction and treatment with peptides, stem cells?
So the question is, any experience with pelvic floor dysfunction? It's huge with Lyme, by the way. Who asked the question? Oh, and I think I'll show you a study on Vpc for incontinence and interstitial cystitis. It works great. But yeah, again, it's an immune issue. We're trying to fix the immunity, get rid of the infection, which is hard to get rid of the infection we found. Just giving antibiotics doesn't work. Because if you're really, and we'll talk about Lyme as a model, why just antibiotics don't work. You have to work on the immune system. And we changed our whole philosophy for these difficult to treat. And so many people with these illnesses, migraines, chronic fatigue syndrome, fibromyalgia, they're all infected. So, okay. Many conditions associated with Th1 to Th2 shift, so it's out of balance, so they can't fight intercellular infections, but they have all this inflammation going on, cause mast cell activation, which is a new thing. So any chronic infection, Lyme and chronic fatigue syndrome are kind of the biggest model for this. Autoimmunity, definitely. Stress, I'm going to show you a mechanism for that. Toxins, really bad. And everyone's toxic. Like, how many people don't have BPA, in their systems? And even they're finding the mothers and the grandmothers' BPA levels dramatically increases the risk of autism. Cardiovascular disease, any gut dysbiosis, SIBO, diabetics, and they all need T3, by the way. Obesity, Th1, Th2, depression and bipolar are huge. And also, remember T3 for those patients. There's one study on, they treated patients, I think it was 135 patients with bipolar depression, treatment resistant. They tried on average 14 different medications, I think it was, without any response. They put them all on T3 regardless of their levels, and 80% responded and 25% total resolution of symptoms.
And when you speak about T3, are you including porcine thyroid, or are you just talking about...
Well, you're going to get some T3, but really, porcine associated thyroid is mostly T4. So the sicker the patient, the more likely they need straight T3. But for the average person, it's hypothyroid. But it's interesting, even they did thyroid biopsies on people who were just fatigued, not even chronic fatigue syndrome. They found the majority had thyroid inflammation, but it was only picked up on biopsy. And they found often that HHV6 is active in the thyroid, but it's dormant in the rest of the body.
So are you talking about Cytomel or sustained release T3?
Yeah, we typically sustain T3, and you'll hear people say it doesn't work, and they're partially right, because PCCA, which is a company, very good, they give all the formulas to the pharmacists, they're like God to the pharmacists, and their preparation for T3, they add so much Methicil, which is a time-releasing agent, and for anyone with any gut issues, it just goes right through. So you end up having to give so much, it looks terrible on the chart. And that's what Armour, I don't know if you heard, like when Armour came out with their new formula, everyone hated it, it doesn't work anymore. They tried to make it time released. And you can't time release T4, it doesn't absorb. So, so all these things, obesity, depression, dieting, talk about that, anxiety, neurodegenerative diseases. Really, you look at your immune system, and I have a little slide at the end how to quickly discern that. Migraines, inflammation, high cholesterol, triglycerides actually. So we treat with these peptides, the cholesterol levels come way down. Okay, so let's look at Lyme here. I won't spend a lot, but it's a good model. So the thing with Lyme is small amounts of this organism stimulate huge amounts of cytokines and a Th1, Th2 shift. So you increase the inflammation, but decrease your ability to fight it. So it goes in your body, starts secreting cytokines to suppress your Th1, and then it goes in your cell. Now it's chronic. And antibiotics, at that point, really you think of, okay, here's your immune system. Let's say it's normal. Up here, you give antibiotics and you get it down. Because antibiotics don't kill anything. Your body has to take over. So you need to get the organism down to this, and the body takes over. But if you're, basically Th1's here, you can't give enough antibiotics. So you got to fix the immune system. And usually what you'll see is a lot of chronically infected Lyme patients, no symptoms or vague symptoms, and then a triggering event, often emotional stress is probably one of the biggest, but it can also be an accident, another infection, mold, and just all of a sudden it's a vicious cycle. So they have measurable hypothalamic pituitary, immune dysfunction, and coagulation dysfunction, and that's why they all look like they have normal TSHs. And so in those papers, I show that really anyone with a chronic illness is low thyroid. So TH1 again addresses intracellular infection, where TH2 is for extracellular. The problem is all these things go inside the cell, and they often lose their cell wall. So when they go in, so now the body's TH2, it just can't fight the infection. Okay. So really, when you look at these patients, I suggest highly that you treat the immune system if they're going to use antibiotics. We've got away from antibiotics. They have their place, but then it also comes down to, we're finding the gut microbiome is so huge, and you take antibiotic. I was kind of like, yeah. But the more research coming out, it's like, and we found, it's rare to have someone take antibiotics and feel normal again. You got to do something else. I mean, you're probably using a lot of immune modulators in your practice. So many, ozone, LDN, even high dose vitamin C, high dose B12, a lot of them. But it's really changed the treatment strategy. So really, immune dysfunction, inflammation is a major underlying cause in terms of wide range of illnesses, especially with aging, chronic Lyme disease, chronic fibromyalgia, depression, anxiety, cardiovascular disease, neurodegenerative diseases, and then just with age, all mitochondrial dysfunction. Anyone with Hashimoto's, by the way, we think of Hashimoto's as just, the body's killing the thyroid, can't make enough thyroid. Actually, the major effect of Hashimoto's is most of them have antibodies to the pituitary, and which to the deiodinase type 2, which increase, and this antibody actually, instead of decreasing T4, T3 in the pituitary, increases. So the T3 goes up the pituitary, TSH drops. So, and what happens is the TSH is inversely, or actually directly correlated. So normally we say a high TSH, low thyroid, low TSH, high thyroid in the body. But it's low TSH with pituitary is getting plenty of thyroid, but the rest of the body's starving.
For those of us who are using like IgG formulations for treating like chronic gut problems to modulate immune system, how do peptides interact with like
Perfect.
IgG?
We use, I love IVIG. I love IVIG. It's getting harder to get approval, but I love oral IgG as well. Yeah, it's very synergistic with everything.
The thyroids that we were talking about, if the labs are normal, it doesn't mean anything.
No, that is the biggest part of the practice. I mean, doctors freak out. Once you learn that, and it can show you, you can feel very confident that you're treating this person right, and they need thyroid, and you can do other tests, again, reverse T3. Sex hormone binding globulin, check that. So sex hormone binding globulin goes up in response to two things, or really potentially three things: the amount of estrogen, the amount of thyroid in the liver. Now, with a chronic infection and inflammation in the liver, it goes up as well. So it's not useful, but a lot of times, if like a woman has a sex hormone binding globulin less than 80, you know they're either low estrogen or low thyroid. So if you know they're normal estrogen, they're menstruating or giving estrogen, then they're low thyroid. So it's a measure of tissue level. You can also do, again, we do measure the speed of relaxation phase of the ankle reflex with a computer. It's called Thyroflex. So British Medical Journal, a number of journals show that a knowledgeable doctor looking at someone's ankle reflex was more accurate than blood tests to measure clinical hypothyroid symptoms and who's going to respond to treatment. And the base metabolic rate too.
can determine which of the 5 peptides would be better, like TB4 versus hepcidin alpha 1 or
Yeah. Yeah, so they're all similar, and probably the most studies are on thymosin alpha 1, and it probably has the most Th1 boosting effect, and it's again approved. It's approved in the United States for orphan drug, but by far most studies, but they're generally all do similar. Like, there's not that many studies on thymogen or thymulin, which some studies like with thymulin shows that, so you get a herxing Lyme patient, thymulin works for that. We found TB4, all the peptides. TB4 and Vpc 157, great for Herxheimer, because it's that immune
How
response.
do you make the determination?
Yeah, it's just pick one. But that's why we came out, we can't do a thymosin alpha 1 because it's an approved drug, and it's too big to absorb. So TB4 has a lot of rejuvenation factors along with immune modulation for basically give someone BPC and TB4 or thymosin alpha 1 with autoimmunity, you'll see their antibodies drop.
And is there anything that TB4 does that TB500 doesn't?
Oh, so difference between TB4 and TB500, same thing.
So they, for all intents and purposes, they're all the same thing.
Yeah.
It's a fragment, the part doesn't matter.
Yeah. Yes.
Is what about hepatitis C?
Oh, I don't have any slides here, but there's some trials, and I don't know if it's approved in other countries.
The question's about hepatitis C.
Oh, sorry, yeah, so what about hepatitis C? I know there's clinical trials get approved as a drug, and studies show dramatic reduction or cure of hepatitis C.
Right.
And it's really true for so many infections that, it works by itself or in combination with other things to get rid of these stubborn infections.
Well, I had someone go through the hep C and supposedly they're now completely cured. So what program were they on if they weren't on yours?
Well, there's meds now. Yeah.
Yeah, the new drugs. So would there be consequences to those drugs that this might alleviate?
Yeah, a lot of these drugs have bad side effects. Its side effects are mild, if anything, and really no toxic side effects. Some people like the Lyme, super fragile ones who can't even take a supplement. You tell them to look at the supplement for a week and smell it for a week and lick it, and then they react to anything, and they actually do well in these things. Yeah. So this is just one of our, when we opened up 22 centers, fibromyalgia fatigue centers, we concentrated on this. This is just kind of to help the doctors treat the different components. But go ahead. Oh, that's just an algorithm to help the doctors, and it's probably 5 times that size now.
You got that memorized?
So most patients, they've had Lyme for a long time, but they're generally asymptomatic or just symptoms that no one puts together. And some patients come in and they're diagnosed with 32 diagnoses, and we test positive for Lyme, but we can pick out a Lyme patient, chronic fatigue syndrome patient, which they're all chronic infected, usually Lyme, by blood work, and tell a very good idea of how severe it is without talking to the patient. So people say, oh, it's just crazy women, yeah, very similar. Also, autistic kids, their labs look exactly the same. But, they get called horrible things. Like one patient in the ICU, and they're saying it's psychological. And that's the thing, if a doctor can't treat it, it doesn't exist, right? So they don't go home feeling like they're a bad doctor. So I don't believe in that, because it's not worth it for them to treat this. They have 8 minutes, So I think the label chronic fatigue syndrome, fibromyalgia, ridiculous. It allowed the doctors to do nothing to look at the underlying cause. So I think it did a big disservice. So after months or years, you have this chronic Lyme, you have this breakdown, TH1's low, TH2's high, and then they may never be symptomatic, but as soon as they get older, have other stress, other infections, you start getting chronic fatigue syndrome, fibromyalgia, MS, autoimmune disease, migraine, depression, bipolar, pain symptoms, even psychosis, Parkinson's, ALS, Alzheimer's. What was his name? McDonald, the Harvard Brain Bank, actually biopsied like huge amounts of Alzheimer's patients, their brain, and found that huge majority were infected with Lyme. But he wasn't allowed to publish because he said, oh, that's too controversial.
So for those doctors who are treating patients with Lyme with combinations of herbal formulas, is this in place of them? Or
No, they work
adjunct
with
to them?
everything. They work with antibiotics, herbals, great. Yeah, it's synergistic. OCD, ADHD, diabetes, lupus, Crohn's, PCOS, PMS. One study on thyroid and PMS, they did TRH testing, which tests for basically secondary, tertiary, pituitary issues so that the doctors don't pick it up. Showed that 90+% had low, basically hypothyroidism, secondary to pituitary problems, and they gave them all thyroid, they all responded. But, endometriosis shown to be an immune problem. Again, hormone influence, but you fix immunity, that goes away. Longer the duration, generally the worse the symptoms. And then other co-infections can be harder to treat. The later stages of Borrelia, again, the TH1 goes down, TH2, so you can check the natural killer cell function, and that will tell you a lot. And you'll find, I don't think I'm getting too much in the weeds, but when you test, let's say, a Western blot, any single band on Quest or LabCorp is a positive. I'm telling you, never, when you do further testing, they're always positive. But they'll have IgM antibodies. And they'll say, well, it's a false positive. You've had symptoms for years. You usually think that IgM goes up, and then it switches to IgG over time. But you need TH1 to class shift from IgM to IgG. So you'll see their IgM positive, and then, oh, that's, and then you treat them, get their immune system better, and all of a sudden you'll switch to IgG, which is actually a good thing. Because IgM are just kind of antibodies that just kind of hold on to the cell like a dog on your leg, where the IgG utilizes complement and explodes the bacteria and sticks much more securely. Hypercoagulation, huge problem. Heparin can change everything in these patients. Going at a time, mast cell activation, also huge. Mitochondrial dysfunction, huge. Remember, all these patients have hypothalamic pituitary dysfunction. So you'll see, like, standard tests will look normal, especially the TSH, but they're low in many hormones. And then you get a vicious cycle. Everything's a vicious cycle. So basically, you need an intact immune system because all these Lyme tests are looking at antibodies, right? And so some people have no bands, and you either treat them with a little antibiotic, and 3 weeks later recheck it, because now it kills some of them, and now the body can see it, then they turn positive or fix their immune system with peptides, and now they're positive as well. Immune modulatory, again, so it really helps the diagnostic portion as well. And really, the immune system dysfunction is the best correlation with how the patient's feeling. Like the level of human transforming growth factor beta, C4A, which unfortunately are getting harder to test, but those are a couple of key markers. So just showing, like, you look at, okay, let's take antibiotics for Lyme. And antibiotics are generally only effective in replicating bacteria. So Lyme, Borrelia is very slow, and then if you give it antibiotics, it slows down even more, goes in a cystic form, goes into basically suspended animation as a persister cell, and then comes back out. But just looking at standard pharmacokinetics and physiology is that, so staph and strep have a doubling rate of about 20 minutes. Borrelia takes 12 to 24 hours, Bartonella 22 to 24 hours, so they're 35 to 75 times longer, and then if you introduce antibiotics, it's even longer. So we usually do, let's do a 10, 14-day course. That's equal to taking antibiotics 24 hours a day for 1.5 to 3 years, to the equivalent. So right there, it's just a couple studies showing Th1, Th2 shift in chronic fatigue syndrome. It's just a graph from a paper, and it showed the direct correlation with the level of Th1 and the progression of HIV to AIDS. So the lower the Th1 and the higher the Th2, the faster they progress.
About autoimmunity, I think you have recommended Thymosin alpha-1 for autoimmunity.
Yeah, Thymosin alpha-1, beta-4, Vpc.
Okay, and then again, is it kind of the same thing where it's like beta-4 versus?
Yeah, it was about autoimmunity. Yeah,
I'm
sorry.
sorry.
No, I'm just trying to repeat the question. I keep forgetting.
Oh, okay.
Yeah.
So again, it's a topic.
I have a slide on that.
Okay.
Yeah. All right. Yeah, so here's just, we're finding every autoimmune disease is infectious. I don't think there's one that isn't. Even they're tapping rheumatoid arthritis, joints, they're getting mycoplasma, getting Hashimoto's, HHV6. Lyme patients have multiple antibodies that come and go, antiphospholipid syndrome. They go to the rheumatologist and they'll say they have mixed connective tissue disease, which means, hey, it's autoimmune, but it doesn't fit any classifications. So it really drives autoimmunity. Oh, and people who have a terrible drug allergy, like a idiosyncratic response, with the HHV6 infection, I think it was 50 or 100 times the risk of having that. Heavy metals, again, shift Th1 or Th2, and as you know, so many people have heavy metal, tons of heavy metals. Recent, if you want to go back one more. This is a quote, recently became evident that the contribution of heavy metals extends far beyond the accepted role of allergic diseases, that it may play a role in other diseases, several indicate. So really, autoimmunity and immune system. Sorry, hurry. So you click it again there. So this just shows how acute stress was thought to lower the immunity, but actually what it does, it lowers Th1, increases Th2, and CRH plays a big part of that. You get mast cell activation, so you reduce cellular immunity, increase hormonal. So acute stress, again, they're not immune suppressants, they're immune modulators that are bad and set you up for so many autoimmune disease and all the other illnesses. And then this shows that kind of the same thing, but is doing the response to adrenaline. So adrenaline has the same effect. Oh, POTS, or does anybody mention that? So we're finding POTS is a huge problem. It's a mast cell activation problem. And I'm in this mast cell mastermind group, and they're still just stuck on treating the mast cells. But you treat the mast cells by treating the stimulation of the mast cells upstream, and much better response. They just keep giving Singulair and histamines.
What do you mean by that? Explain how you treat the upstream of the mast cell.
So as the two previous slides showed that how the Th1 and Th2 conversion stimulates mast cells. And CRH is huge too. So look at their cortisol level, ACTH. So if they have high ACTH, even if the cortisol level is normal, they have high CRH, because that's stimulating the ACTH. You want to give them a little bit of cortisol and lower that ACTH if they have any mast cell issues. And then BPC, thymosin alpha-1, thymosin beta-4, even delta sleep, Cmax, C-link, can all suppress mast cell. And grapepots. So here's just your thymus with age, and you can see how it totally drops. It basically involutes and shrinks right around between age 20 and 30. Go ahead. And yeah, so thymus involution is influenced by age, obesity, lifestyle, stress, toxins, hypothyroidism, growth hormone, zinc. And so you get more susceptibility to infections, inadequate immune response, increase for autoimmune disease, cancer. So TH1 also monitors your body for cancer. So a dramatic increase in cancer, increased cardiovascular disease. So this is the CDC. According to the U.S. Centers for Disease Control, approximately 80% of aged individuals are afflicted with at least one chronic disease as a result of the decline of thymic function. And so obesity, calorie intake, again, also pineal gland dysfunction. So it shows like why after a certain age we just seem to be so prone to all these illnesses. So give them some thymus. Looked at thymus scans post-mortem, and they found it was autoimmune disease.
What do we know about pineal gland calcification and why does it occur?
Yeah, I mean, it's just associated with age. And like, heart disease. So but the pineal gland stops working. That's a sign it just kind of.
Is it like an
aging.
atherosclerotic process or what?
Yeah, it's a marker for dysfunction.
Are there lifestyle factors that influence it?
It's age especially, but all these lifestyle factors. Same as for thymus, and they work together. The pineal gland stimulates the thymus, so that's low, and that's the epithelium. Is the pineal gland hormone that will hopefully we have enough time. We'll get to how it's. Just they got human studies, 15 years long, showing dramatic increase in longevity, cancer, all those things. It increases telomeres. So your thymus scans they found abnormal thymus scans post-mortem in all autoimmune patients, which makes sense. So again, thymic peptides, what do they do? Lots of stuff. Improve tissue repair and healing, there's references there. Improves host defense of infection, reverse immunosuppression from like Lyme and other reasons. Increase antioxidant glutathione production, boost natural cell function. Again, the TH1, TH2 modulation binds neuro and endotoxins, mold toxins, cardiac regeneration. Neurologic regeneration, whether it be traumatic brain injury, Lyme, Alzheimer's, neuropathy, Parkinson's, and that together with Vpc and epithelium, excellent for these Parkinson's and Alzheimer's patients. Stimulated stem cells are great to give with stem cells. Using stem cells, use the peptides with them. The patient will save a lot of money. Or everything else. But so kind of the same thing. Basic anti-tumor effects. For Alzheimer, use it. It normalizes blood pressure in hypertensive patients. Multi-chemical sensitivity patients do really well.
You can't help but think that peptides do everything, and it sounds too good to be true.
No, it's true when you say that. People are like, oh yeah, it's a magic potion. And so there's tons of, you can't believe the amount of studies on this stuff.
And there's no toxicity, that's hard to believe, especially since like insulin is an example of a peptide. We certainly know the problems with too much or too little.
Yeah, they've done on these ones, they can't get to a toxic level. I mean, I did myself, I did 100, again, times the normal dose IV, nothing. Yeah, again, so there's so many things that it works great for. Any inflammatory, chronic infections, any cardiac, brain issues.
What's the protocol for traumatic brain injury concussion?
I mean, there's a lot of things. It depends if you're able to do injectable stem cells, and exosomes are great. Cerebrolysin, progesterone, actually. C-Link, C-Max, Vpc, TB4, all shown to help. And some of the studies are dramatic.
So you had mentioned that for the VPC, there's no real difference in efficacy with oral versus injectable versus IV. What if you're trying to do something specific like on a joint or for musculoskeletal? Would you want to do something more local?
It makes sense, and we'll still inject it in the joint if we need it, but we had a friend who had, again, I talked about the knee pain, just gave her the capsule, you know, it's gone. So we know, I'll show you a study on MS with oral BPC. So it works, but if you do have access, yeah, put it where it's needed.
I saw a few videos online where people were treating tendon injuries and they were using the triangular pattern of injection around the tendon.
Yeah, that makes sense. And we'll do stem cells in the area with peptides, ozone, you know, prolozone. He's kind of the master of that. And he doesn't, if the patient's not better by the time they leave, not the office, the room, he doesn't charge. Here they gave bioidentical, basically this is this thymic protein injected in mice starting at age 3.5 months. Prolonged the lifespan by 28% and decreased the cancer rate 2.8-fold. This is just interesting how it shows that TB4 is actually very antimicrobial that not many people know, and shown to improve in this study. Use it with Cipro for Pseudomonas, and so it works great as an adjunct to any antibiotics. And I don't know if I have a slide, but they found now that C. diff cannot survive without Pseudomonas. It's too, it basically can't handle that much oxygen, and also Campylobacter jejuni, which if you're doing stool tests, you see some people come up with that. And maybe you treat the Pseudomonas, then those go away.
Question back here.
I just want to make a point about, at the Kreisky Eye Institute, they study eye injuries and use TB4 all the time with remarkable results. And one of the other things that they use with TB4 is SPMs. So they love Metagenics, SPMs, and TB4, and they topically just drop it in the eye and get amazing results. And I've had cataract surgeries that have gone bad be repaired just using TB4 and SPMs, drops in the eyes.
Yeah, and this is Kathleen O'Neill. She lectures all over the world on peptides as well. So at the end, I'll probably bring it up for any questions, different insights. But yeah, she knows her stuff. And yeah, I do them myself. I have terrible dry eye, and nothing worked. The stasis didn't work. And so I use a combination of TB4, I use TB4 fragment, and BPC. And I was using it every day, now I probably use it twice a week. I couldn't work contact.
I interviewed Dr. Sandy.
And you can also do like exosomes and stem cells in the eye. Some great studies at that stem cell conference with macular degeneration, and I mean, really well done studies.
I guess there's carnosine eye drops also that.
Yeah, and like cataracts they're from oxidation. So any antioxidant drops, and that's one that's sort of common. But again, modulating the immune system even better. But use them together. So like thymosin beta-4, they looked people in septic shock. It was undetectable. So is it suppressed, used up? BBC as well, one of the best things to protect liver against so many insults from bacteria, toxins, OPS, prevents fibrosis. So if you have a liver patient that has cirrhosis, you can reverse it. We've got people off the transplant list, and her mom's on transplant, but she was taken. Yeah, it prevents a hangover too, by the way. So here's TB4 for neurologic disease and neurodegenerative diseases. There's a bunch of quotes in that, but for time. And again, very synergistic, it boosts stem cell function. And so here's just some information on the fragment. So similar benefits, the N-terminal for peptide, and it's antifibrolytic, shown to prevent, so orally, organ fibrosis, number of studies on diabetic kidney disease, reversing that, preventing fibrosis, anti-inflammatory, accelerates wound healing, enhances angiogenesis for healing. And that again is available orally. Now TB4, one of the problems is it has a mechanism, by, again, changing the Th1, Th2, reduces mast cell activation, but there's one part on the TB4 that stimulates mast cells, so we got rid of that. So basically, the fragment has a little bit of mast cell activation, but it's by far overtaken because of immune modulation. For breast implants and silicone. So you can give it and it will resolve and nodules will go down, silicone deposition in the lungs. So it worked well. I wonder if it'll work for the vaping injuries. I don't know.
Yeah.
So myocardial infarction orally, dramatic will prevent cardiac rupture, which is a weakening of the heart, and actually also post-MI. So here's this, prevents cardiomyopathy, and your dad should get some of him. Dad's chief of cardiac radiology, I think, at Cedars, the EO hospital. But diabetic patients, ideal for these people, reverses the diastolic dysfunction they get, fibrosis, inflammation, so slide showing all that stuff. So we had oral, reverses kidney damage, type 1, type 2, diabetes. So we'll go on to Vpc, and this is probably the #1 thing, by far the biggest peptide we sell, and it just helped so many people. Just give everyone T3 and Vpc, you'll get a lot of referrals. Great at repairing the GI tract, inflammatory bowel disease. We had an 8-year-old come in with was also under Crohn's, but been doing everything, chemo stuff, and they were going to do a colectomy. I'm like, no. And she turned out to be a friend of his family, but I didn't even know. And she's so thankful that she just doesn't have the symptoms anymore, just flooded stools and just.
Well, question back here.
Over there. Have you treated SIBO with this at all, with VPC?
So the question, have we treated SIBO? And yes, and probably we don't test it as much, we just know it's there. And we find it goes away, or the big bloating, then that will go away, so we don't, so it works.
Dr. Marr is using it a lot for SIBO patients.
Oh, yeah, he buys a lot.
How do you dose that?
So standard dose is 1 twice a day, but you can go as high as 3 caps 3 times a day. Yeah,
L37 would be a pretty good placebo, right?
yeah. Yeah, we haven't used, we kind of wait a little bit for that because there was no literature on the dosing, and I tried a huge dose. Oh my God, it jumped out of my skin from my Alzheimer. But we usually add that in. You want to fix the immune system first, and then bring the L37. L37 also is an immune modulator as well, so it works multiple ways. But yeah, it's good.
It seems like most people do well at 100 micrograms a day for 6 weeks. Great.
Yeah, that makes sense. We just start really low for some of the sick patients. Irritable bowel.
Oh, another question in the back.
Just wondering, when you give this orally, what prevents the small chains of amino acids from getting cleaved by the trypsin?
Yeah, they don't. Yeah, they're resistant to, it's a gut peptide, so it's very stable and absorbs, so it doesn't have any issues in acid from the enzymes. It's resistant. The structure somehow prevents the degradation, which is a big problem from giving peptides orally in general. But the ones we're using, they don't have that issue.
They don't get digested at all in the GI tract?
No.
So, okay, and then my other question was about, are you using it for something like silicon sequestering and reactions to implants? Do you have to inject it to the site, or did it take those oral?
Honestly, I haven't done it. I just came across that study 2 days ago. So, yeah, we haven't had patients. We've had some of the Lyme patients get their breasts removed, and some of them had huge silicone all over. But I can't say that I've used it for that.
I would never inject that into a breast, for sure, especially if there's silicone, because the incidence, even in saline breast implants with silicone in the surrounding part of the implant, there's a large, I have 3 patients in my practice with anaplastic large cell lymphoma that's due to silicone breast implants. So you don't want to be messing around with that. You want to definitely advise that they take it out. That's called Asia syndrome, autoinflammation syndrome induced by adjuvants or silicone, so you definitely don't want to inject it to the implant.
Yeah, and I'm assuming they've gotten taken out. If they haven't, I wouldn't treat them. If they've kept them, that's worth it to them, Then, yeah.